Welcome to the MAHEC Pharmacy Residency programs in Asheville, North Carolina. An international destination for outdoor adventure, a vibrant art scene, and a thriving mountain culture all its own. Even our facilities are unique. We share a campus with learners in UNC schools of medicine, public health, and dentistry, and a robust array of medical residency programs and ambulatory care practices.
So the first thing is just the training location. So being in family medicine, they have the opportunity to do almost all their training in the outpatient setting, and so that's different than most PGY1s, which are in the hospital. And then, of course, we love family medicine because it's cradle to grave, it's babies all the way to people who are in their 90s and 100s, so you really get to take care of the full spectrum of ages and also conditions.
Here, residents train alongside healthcare professionals from a variety of disciplines, all dedicated to innovative education and best practices to improve our region's access to high-quality, equitable health care.
MAHEC for me, the second I stepped on campus, it was welcoming, it was warm. The people here are so compassionate, and you see that in their patient care, but you also see that with how they interact with one another. And so that family feel is really what drew me here in the first place, on top of all the other opportunities. I just felt like there was a myriad of opportunities that I really wanted to focus on, and I just felt that the mentoring also was above anything I've ever seen, and it's really unique to have that support, especially in the pharmacy world.
Pharmacists are fully integrated into our clinics to ensure patients and providers have ready access to experts in pharmacotherapy and disease management. Our pharmacy residents are valued members of the care team from day one, working closely with medical residents and faculty to support optimal patient outcomes.
In MAHEC Family Medicine, we have a model of interdisciplinary care. So we have the faculty physicians, the resident physicians, the pharmacists, the nutritionists, and behavioral health all working together, sometimes at the same time, to work with patients to improve their health and their well-being. And my role is to be part of that team and to implement and help with lifestyle interventions as part of that.
So a lot of my interests lay within working with populations like Spanish-speaking populations, patients with Medicare, and making sure that we reach people that aren't getting the access that they need.
¿Has notado cuando necesita usar técnicos?
Siento que me ayuda cuando voy a tomar un examen en la escuela.
Residents develop strong relationships not only with clinical pharmacists but also family medicine, OBGYN, geriatrics, addiction, and psychiatric faculty who are committed to teaching through precepting, didactics, research, and mentoring.
One of the greatest things about this residency is that it's so interdisciplinary. This is something that I talk about with our medical residents all the time, and as I'm interviewing for slots for my residency, it's a key point. We have pharmacy integrated at a really, really high level. How that looks here is that the pharmacists are definitely involved in the inpatient team. That's a very common thing now, especially in big university programs. But maybe uniquely and to a much greater extent, our pharmacists are doing interdisciplinary work with us in the outpatient setting. And each of those places where they're partnering with us in the care of our patients, they are creating opportunities for learning to happen in both directions.
One of the things that makes MAHEC such a fantastic place to train is the fact that the culture is so steeped in teaching and learning. So not only are faculty, regardless of their discipline, really and truly dedicated to the learning of the residents, but the residents themselves are also presented with boundless opportunities to perfect their own teaching skills.
Mentorship here at MAHEC is fantastic. I really feel so at home as soon as I walked in the door. I feel like with my program director, I've grown to be just in a really great relationship with her. She's somebody who's so approachable. Even the other faculty that I get to have the pleasure of working with are just so supportive and really want what's best for me and really think about my learning and my growth as a resident and as a future pharmacist who will be practicing independently soon. There are several opportunities also here to engage in other parts of the research process, so you could even jump in at a project where they might be near done with data analysis and collection of data, and you be involved more with that side of it and then publishing and writing the paper.
We really think that helps to mimic the experience of scholarship in practice, where you're working as part of a team and that research doesn't fit nicely into that one-year timeline, and it might take several years to develop a really meaningful research project with valuable results. And so I think that's unique about our research program, and I think a great opportunity for residents. So the Ambulatory Care PGY2 residency program I think is really unique because we place the PGY2 resident in primary care practice sites across the region that don't already have a pharmacist. And so they spend the year really building out and developing the clinical pharmacy service in that site and developing a business plan, a pro forma, to help support that position after the residency year. And then it's also really great for our region because it allows us to put clinical pharmacists into practice sites that wouldn't necessarily be able to have them otherwise. So it really extends the reach of pharmacists in Western North Carolina as well.
What I found very unique about MAHEC is it's almost like 3 residencies in one. You are continuing to build your ambulatory care skills, working actually at MAHEC, so that's one slice of it. The other is that business plan development and development of your own clinical practice at another site, which is the part that I enjoyed most because that's something that we completely don't learn about in pharmacy school. And then that third slice was in academia. So we really had an emphasis on teaching other pharmacy students, doing small group facilitation. And so just great to have those 3 experiences is unique to this program.
MAHEC's team-based approach provides numerous opportunities for residents to practice at the top of their license while working with experts in a variety of fields to care for patients across the lifespan.
So when I think about how the pharmacy residents really work and enhance the Project Care program, there's a lot of different ways. Number one, it's a really great opportunity to really deliver interdisciplinary care. Who better on the team to be able to champion medication access and understanding the ins and outs of how really the pharmacy system works than a pharmacist? So having the residents be part of our program not only has brought advocacy to our staff and patients, but it also has really educated the medical and behavioral health staff of a whole nother part of healthcare, which is the pharmacy department. It's a pretty exciting integration, I think, for patients to have that opportunity to sit with someone who understands their meds so thoroughly.
Our academic setting encourages the sharing of ideas in our classrooms, innovation spaces, and outdoor courtyards, as well as on our region's many mountain trails. While here, you'll have numerous opportunities to engage with colleagues.
In places like MAHEC that are very innovative in the way that we do care on interdisciplinary teams, we make up for some of the holes that might otherwise occur in healthcare by partnering with one another and trusting one another. Any moment becomes a teaching moment. It's not just these specialty clinics that they're involved in, but when my residents come into precepting to check a patient out, to me, there's a PharmD specialist there who can step in and make a recommendation and make that much more comprehensive care for the patient and a learning opportunity for everybody involved.
Learning opportunities extend well beyond MAHEC's campus. Residents in our second-year programs can choose a focus on developing pharmacy services or work as part of a team caring for older adults in their homes and in skilled and assisted living facilities.
We also have strong affiliations with a lot of different other patient care organizations. So for example, PACE, which is the program for all-inclusive care of the elderly. And this is more of an adult daycare program where we can provide them all the care that they need at that one place. So there are several partnerships that we have with all sorts of practice sites across Asheville that help us engage in our training.
With the program, we're really shooting for more than just developing truly excellent clinicians. So in addition to being experts in all of those areas, residents graduate from the program being really truly comfortable navigating higher levels of academia so that they are able to function in an academic role and help to nurture passion for geriatrics in the future pharmacy workforce.
Here at MAHEC, we have developed residency programs with a reputation for excellence in primary and preventative care. We are excited that you are considering our programs, and we look forward to sharing how we can help you put your passion for healthcare into practice.